All right. Good afternoon. My name is Tom Barrymore. I'm here to talk about the administration of CPAP. Okay, CPAP is a treatment modality we use for patients that are in respiratory distress. What is CPAP? CPAP stands for continuous positive airway pressure. This continuous pressure will open up the thoracic cavity, allowing for fluid to shift in episodes of pulmonary edema. This also allows for decreased venous return and reduced preload when we're discussing pulmonary edema. As far as when you're having bronchoconstriction or bronchospasm, forcing air into the lungs to allow the gas exchange to occur is what CPAP can do for those patients. There are two different types of CPAP. There's the easy flow CPAP, which is the one that we'll use today, often seen in EMS departments across the country nowadays. It's simple. You just connect it to an oxygen source. You have your manometer right here, and depending on how much oxygen is coming in will be dependent on how much pressure you're applying, and we'll discuss pressure a little bit later. Then there's the traditional CPAP, which is a more mechanical CPAP. You can see here there's a pressure gauge, and you just adjust the pressure with this knob right here. This was a lot more cumbersome. There's a lot more wires and connections involved with this, as opposed to just connecting it to one single oxygen source. These are far more common nowadays, and these are kind of phasing their way out, but you may still run into the traditional mechanical CPAP at some point. So what are the indications for CPAP? Indications are pulmonary edema, bronchoconstriction, and any sort of increased respiratory effort. If we're not sure if we're going down pulmonary edema or bronchoconstriction, bronchospasm, but we do have an increased respiratory effort, we are indicated to go ahead and give CPAP as a benefit for those patients. We'll talk about the contraindications next, but if you see a patient in respiratory distress, even if you're not sure if it's pulmonary edema or bronchoconstriction, bronchospasm, you are more than likely going to end up placing them on CPAP regardless of it, so go ahead and get it done quicker. Contraindications, hypotension. Since the CPAP will actually reduce venous pressure and reduce preload, it has the potential to lower your blood pressure, typically more in prolonged exposure of CPAP, but if somebody is already hypotensive to start, we don't want to bottom them out, so hypotension is a contraindication. The inability to protect their own airway. Oftentimes in protocols we'll see altered mental status, and altered mental status could be they're confused but still walking around, still able to protect their own airway. So more specifically, it's not about their altered mental status and more just about their inability to protect the airway. Anytime you have a difficulty getting an adequate seal, if you cannot get an adequate seal with a CPAP for whatever reason, maybe limited resources, or the patient has wounds or damage to their face, making a seal difficult to acquire, then we're not going to use it because it's not going to be effective if we don't have a good seal. Little to no respiratory effort from the patients will be a contraindication because they still need to be breathing for this to be effective. We are going to apply positive pressure to their already normal respiratory drive. So if the patient is not breathing on their own, we need to move to ventilation. We would no longer use CPAP. Okay. All right, so what are we going to do when we're prepping for CPAP? First things first, we're going to check our supplies. We've got two different types of masks here. With the plastic mask, it's a plastic mask that has some air deflated out of it to kind of give it a cushion so that it can make a seal. Sometimes when you check these, you want to make sure that there's no hole causing leakage, or where the mask is completely deflated and it wouldn't actually sit on their face. These actually I find to give you a lot better seal with the foam mask, but sometimes if they've been sitting for a long time, that foam is pretty stiff and rigor and it won't actually adhere to the face all that well, so make sure we're checking your equipment. All right, when we go ahead and talk about your straps, just make sure that your straps are there, more or less. Make sure that you're using a new strap so that this is not already been pulled, taut, and it would loosen your seal. And then this, you just need to make sure that it has all the correct pieces and that you're connecting it to the oxygen source, and as long as the oxygen is coming through, you are doing a good job. There's no issues there. We want to check our oxygen supply, right? Because we want to make sure that we have plenty of oxygen. CPAP does take quite a bit of oxygen, and so we want to make sure that we have a good amount of oxygen in our tank before we go ahead and set up and apply CPAP. Make sure that you have enough people around. CPAP is best done with 2 providers. It can be done with 1 provider, but it will be easier, more effective, faster to have 2 providers. And the reason for that is everything with CPAP has to do with maintaining a good seal. If we don't have a good seal, you will notice the air is coming out the sides of the masks, and then you're no longer getting that positive pressure, not to the same extent in which we want it to be at least. So having 1 provider to hold that mask in place and on the face, while the other one actually secures the straps, is probably the ideal way to do it. Consider other forms of oxygenation prior to the administration. If during the setup process you take a look around and you realize that we've got a lot to do to get this patient on CPAP, maybe they're in an uncomfortable area that's difficult to get to, and we're not going to be able to get there and get a quality seal, or maybe we don't have enough providers on scene already, and we want to wait until we have somebody else. I would not delay the administration of CPAP for the extra providers, but if you have the ability to get someone there in a timely manner, it would be easier for you. Then obviously consider another form of oxygenation while you're preparing the CPAP, if at all possible. Okay, that means we're going to be placing these people on cannulas or non-rebreathers, or even ventilating them with positive pressure while we set up our equipment and get prepared. How to apply the mask. Okay, so we have a foam mask and a plastic mask. We talked a little bit earlier about how they can degrade in their packaging, how this can get a little stiff, how this can lose some of its air. It's a personal preference. There is no right or wrong way. Both of these will be effective in certain situations. It's whatever will get you the best seal. I tend to like this foam mask because, again, it adheres to the face just a little bit better than this mask does. And so oftentimes I will pull the foam mask out right off the bat. Go ahead and make sure that you connect the oxygen. Once you connect to the oxygen, just make sure that the oxygen is running. You do not need to necessarily set your pressure just yet, because the pressure that you are going to be using may change as you place it on the face. Okay, but we do need to make sure that oxygen is going through the mask. Apply the mask to the face. We'll do this here shortly with a real patient so we can get some hands-on experience. But when you're applying it to the face, you want to make sure that you're checking around the mask to make sure that there's no leaks or seals in the mask, right? So it's important to drag your finger around the side of the mask looking for leaks where air is coming out, whether you're using a foam mask or a plastic mask. Use 2 providers if at all applicable. Like we talked about earlier, we want to use 2 different providers to maintain that seal the best of our ability. If that is not possible, absolutely CPAP can be placed with a single provider. It just does make it a little more difficult, especially for an inexperienced, somebody who's not done it that many times. So if you are one of those people that would fall into that category and you have the opportunity to use 2 providers, please, at all times, use 2 providers while you get comfortable with the application of CPAP. How to secure the straps, right? So to control the seal to the best of your ability, while you are applying the straps, you're going to apply them diagonally. So if you start in the top right corner, the next one that you're going to apply would be the bottom left, right? And then we go to the right and then to the other side. And we'll show this with a real patient. It'll be a little bit easier to see, but you want to do the straps diagonally. And it's okay if you're gonna have some leaks in the seal while you're applying the mask. That's totally understandable. While you're trying to get that secured, you're gonna move the mask a little bit, and it's expected to have a leak here and there, but important that we go ahead and reassess after we secure the mask to make sure that we are not actually having any leaks after it's been secured, okay? And then as we talked about earlier, secure the straps diagonally across from each other. Adjust the pressure, okay? So this is something that, again, we always want to check our local protocols, okay? But a typical rule of thumb for bronchoconstriction would be 0 to 5 centimeters water pressure is what you'll set the CPAP at. The pulmonary edema, we're at usually 5 to 10. And this is going to be set to an amount where you see the benefit for the patient. So if you place it at 5 initially, saying, hey, we're either one of these two, we don't know which one it is yet, we just see increased respiratory effort, we're going to place it at 5. That's a good starting point. But if you identify that there's pulmonary edema and then the patient is still struggling after the application of CPAP, we need to increase that pressure so that we are getting the therapeutic benefit of the machine. So then there's easy flow versus mechanical. Easy flow, the way you adjust the pressure is simple. You just increase the oxygen. And you'll see on this manometer here, there is a chart, 5, 10, 15, 20 cmHTO, that's centimeters water pressure. And so with this, all you do is increase the oxygen source up to 10, 12, 14 liters, and you'll see this ball rise, and that'll tell you where you're at with the pressure. Easy flow is called easy flow because it's so simple to adjust the pressure. In comparison to the mechanical CPAP, if you remember the box on the screen that we were looking at, the mechanical CPAP actually had a dial that you need to adjust the pressure with. You physically go in and move the pressure, and the box will set the pressure. Again, those are a little more outdated. We don't see those as much, but you do need to be prepared to go ahead and adjust the pressure using both. So always check your local protocols. Do not run off these numbers. These are just a guideline. But then, again, as always, we will reassess the seal after we adjust the pressure, because when you add pressure, if the mask is too loose, you will start to get more leaks in the seal as you increase the pressure. Okay, what do we do after we apply it? So now that we have the CPAP on, we've secured it, we've ensured that we have maintained a seal throughout the entire process, we've reassessed, we've made sure that that seal works. We're going to monitor for vital sign trends, right? That way we can determine if the treatment is still effective. If we notice that the SpO2 is trending downwards, we may need to adjust the pressure, right? If we notice that the patient is becoming hypotension, they may need less pressure. So we need to monitor the vital signs for trends, okay? Monitor the seal for leaks. I'm beating a dead horse here, but the worst thing you can do is apply CPAP with a leak or multiple leaks, because you will not be getting the effective treatment that way. So continue to reassess regularly, listen to lung sounds, make sure you're no longer hearing rales or bronchoconstriction, or if you are, that you're hearing movement within the lung passages, okay? All right, so let's go ahead and put it all together. I'm gonna have my son, Deacon, come over here and help me with the application of CPAP, and my beautiful assistant, my wife, will help me kind of walk through this process. We'll start by doing a 2-man technique, and we'll show you how it's done. So if we're looking up here, what is the indication for CPAP? Well, we'll say he is a 55-year-old man, and he's complaining of chest pain, shortness of breath. We listen to his lung sounds. He's got fluid in his lungs, so we know that he is indicated for CPAP. Are there any contraindications? Well, we did an initial set of vital signs. He's not hypotensive. We do not see a reason we're not going to be able to get a mask or a good seal with the mask. There's no contraindications noted for this patient. Are we prepared for CPAP? Well, we don't have an oxygen tank today. We will verbalize the oxygen tank, but we do have the requirements here. We've got a mask. We've got 2 different types of masks that we could try. And then we have the CPAP Easy Flow to go ahead and set up, and we have the straps. So we have everything that we need to apply it. Are we prepared for CPAP? We have 2 providers on scene ready to do CPAP, and we've got enough hands to go ahead and administer this safely. So we'll start by connecting the oxygen, right? We connect the oxygen to this. We notice that oxygen is coming out, so we've got a good tubing there. So then we need to determine, do we have the right mask, right? So we have 2 different options here. We've got this one, right? How's that feel? Can you blow against it? Go ahead. Yeah, see? And we can notice, even with covering the hole, as he blows, it doesn't fit him all that great. We're getting some leakage up around the nose. This is probably too big for you, right? Let's try this one. See, now I can push down. Go ahead, breathe more. Okay? Notice we're not having any leaks come out. Do you feel air coming out anywhere? No? Yes? No. Good. All right, so now that we have a good mask, we have a better seal with this. Good job, buddy. We have a better seal with this mask, so this is the mask we're going to use. So we're going to go ahead and connect the mask to our oxygen source. All right, and I'm going to have my lovely wife be the single provider who goes ahead and applies the mask. So we've connected it to our oxygen source. We've got oxygen going so that the patient is going to receive oxygen, but we're not all that concerned about the pressure just yet. So while she's holding it, we're going to check and make sure we got a good seal. I'm running my fingers around it. I'm not seeing any of the leaks in this seal. That's a good sign. Okay? So we go ahead and we'll start with the top right. And all you need to do is go ahead and you'll see here that there's little hooks on the mask. And we're going to put the whole of the strap through the hook. Now we're going to come around and go on the other side, diagonal to what we've got here, working around my wife's hand, right? And so she's going to maintain that seal. And then we're going to come up here and we'll put another top one on, right? Maintaining that seal. See, with all this extra movement while I'm placing it on him, we're getting movement in the mask. My wife is doing an excellent job of holding that straight and making sure that it sits good. Now we let go and we would check for more seals. Breathe real good, bud. Breathe out. Okay, we're not feeling any leaks in the seals, right? So then from there, we just go ahead and change our pressure. So we have an easy flow. We've got it connected to oxygen. We'll say since he's having pulmonary edema, we're going to increase it to 15 liters a minute. And watch as this manometer ball comes up, and it should be sitting between 5 and 10 with that amount of oxygen flow. Okay, so then we set our pressure. Now that we've set our pressure, we reassess, make sure that there's no leaks in the seal. Now that we've reassessed the pressure, there's no leaks in the seal, everything looks good, we are all done. We continue to monitor and reassess the patient, right? Look for the trends and the vital signs. Now, hang tight for just 1 second there, buddy. If you don't have the ability to do it with 2 different providers and you have to do it all by yourself with 1 single provider, that is going to happen. We work in EMS. It is always moving, always evolving. There's always something going on, right? And so we may be in a situation where we don't have extra hands available, and the best thing you can do is just try to keep that seal as tight as possible throughout the process. Understand that you will be losing a tight seal at times while doing it yourself, but the process is still the same. Okay, so you're still going to check your oxygen equipment, make sure everything looks good. You size the mask. We know this one fits you better since we just did it, right? And then we'll go ahead and connect the mask to the oxygen, turn the oxygen on. Again, not worried about the pressure. And we're just going to make sure that it's delivering high flow oxygen right now. We're going to put the mask on. As we put the mask on with 1 hand, we're going to go ahead and try to maintain that good seal. If we got to put 2 hands on it, we can, just to find out where that seal is going to sit. Because after we get the mask on, we will adjust it. okay? So don't be afraid to just put the straps on and realize we're gonna adjust it later, right? We will make it work to the best of our ability. So we put it on. Ooh. To the best of our ability here. I know it's tight, I'm sorry, bud.
That's fine.
All right, so then now once we got it on, I can see this is pulling down a little bit, so I'm gonna pull the headpiece up, make it sit a little prettier on him. All right, now try to breathe. Breathe out. Not feeling any gaps, okay? So again, once we're done with this, we'll go ahead and reassess, monitor vital signs, and look for trends in vital signs to make sure that we are not missing anything. But that is how you apply CPAP. Is there any questions? Dee, do you have any questions?
No, I do not have any questions.
Thanks, buddy.